Yeah, so I think there's a number of things with respect to patient acceptance of AI that need to happen, and I do think are beginning to happen. First, it's just helpful, although also a bit of a double-edged sword, that patients, just like all the rest of us, have the ability to play around with more and more AI tools in their general lives, not necessarily just restricted to healthcare. So for example, people go on ChatGPT. Sometimes if you use Google now, you get an AI response. Maybe at work they have some exposure. I think that kind of general democratization of what AI is, what it can do, just getting a feel for it is helpful. But in healthcare contexts, the trust aspect of those kinds of tools becomes really important. And that's where the double-edged sword part comes in, right? We all read the headlines, maybe have personal experience of AI tools that give crazy answers to questions that people ask. And when patients in general think about how that might apply to use of those tools in their health context, it's obviously reasonably scary. So I think to kind of chart this course, we have to just be honest about what AI can do. It's a very powerful set of tools that give significant advantages in some areas over tools that exist, but it's not perfect. It's not magic. It's not always right. It's no more or less than a latest technical advance that, when used appropriately by experts and by, importantly, the patient's physicians, can help those physicians in concert with the patients make good decisions about their healthcare. So that establishment of trust located in the expertise of the clinician as something that helps them, not replaces them, is critical. With respect to evidence that this is going on, it's only a few months into the year. I can't say I see massive evidence yet. But what I can tell you anecdotally in conversation is people are getting more comfortable with the idea that AI is a tool that takes data and gives me some information. And if we keep sort of on that track, again, not that it's going to replace anything, whatever, but just that it's taking information and putting it in the hands of my doctor to help me with my heart problems, to help me with my depression, to help them guide me in making the best decisions for my health. That's where I think the change will happen. I think dermatology, is interesting from a number of perspectives with respect to AI adoption. First, I think dermatologists, at least my personal experience in working with them, have a very nice balance between interest in tools that use data in novel ways that provide, treatment-based insight, but also a sense of practicality, a sense of getting past whether something looks good academically, is this actually going to help me in practice? So I think, dermatology is certainly a field that's open to a lot of this kind of adoption. I don't think dermatology or any other field of medical specialization, frankly, is saturated or mature with these tools yet. Otherwise, when we walk into our doctor's office, that would be our experience. But I think they're on the way. There is a unique opportunity with respect to dermatology's interests in imaging data and the ability of AI to read and understand and classify images that I think will help the field and the specialty with some of those lower hanging fruit use cases. Um, I also think that the utility of some of the emerging applications in dermatology shows what AI can do. I mean, in our work, we've been working, with the academy to use AI to find patients who have rare dermatologic disease but are not yet diagnosed with those diseases. And this notion of finding patients who need specialist care or sort of languishing with symptoms that are not being appropriately treated because they're not diagnosed is something that's resonating in dermatology. And I think the more we can do that kind of work and close gaps of diagnosis and treatment, that'll be quite powerful. I was speaking about I suppose the advantages a moment ago of the necessity of visual information in dermatology and the good things that AI can do with visual information, right? Helping to kind of quickly triage, does this look like, something benign, something serious, ABC, take some workload off of providers, at least in helping with a preliminary sense of what's going on. That's the good side. I do think that there is I don't know if disadvantage is the term I'd use or just a caution, but we talk a lot about bias and representation in both AI system training and application. And I think when we're talking about using imaging data, we have to be doubly or triply careful that we're not using algorithms that have learned on skin that looks like one thing and applying those blindly to people that look different without thinking about the consequences of that. So making sure that we have good and representative training data, and even if we don't, making sure that we're not careless in how we use these tools. If we do that, in other words, if we are careless, I think the AI can do more harm than good, and will also damage the trust that patients and dermatologists have in these tools. So we have to be very careful in taking advantage of that unique opportunity we have in dermatology with imaging data.